Good day. Today I would like to discuss something about type of cancer called Myelodysplastic Syndrome. It's popularly called the myelodysplasia and abbreviated as MDS. It's usually not one of the most terrible cancers. It develops slowly and that makes its treatment not done straight away. It is a hematological malignancy, a cancer that usually affects matured people. In explaining myelodysplastic syndrome, the name itself explains it. Myelodysplastic and syndrome. Myelo means the bone marrow, which is the spongy tissue found in the long bones that produces myeloid cells. In mentioning dysplastic, when you say a dysplastic cell, it's commonly the abnormal cells that are found during a film comment. And it is called a syndrome because its overall symptoms are due to contributions of the various defective cells in the myeloid lineage. It could be red cell dysplasia leading to anemia, or thrombocytopenia causing bleeding issues, or neutropenia getting you prone to infections. It is not usually one of those terrible cancers. However, its transformation to acute myeloid leukemia, AML, makes it a clinical emergency. Someone will say, then what's the cause of this type of cancer? Just like I said earlier, there is no one specific cause of this type of cancer, but retrospective studies show that people who are over 70 years are commonly affected. Also, males are prone to this type of cancers. Based on research, benzene has been popularly involved in people who have this type of cancer. Benzene is this chemical found in substances like petrol, rubber industries, and as well as cigarettes. To conclude with, people with Down syndrome also normally have these abnormal dysplastic cells, the MDS. It is not usually cured, however, the symptoms are managed. What we should know is that myelodysplastic syndrome, MDS, is dysplasia, abnormal cells, whilst leukemia reaction, which comes during a very severe infection, is just a hyperplasia, production of excessive number of white cells beyond the normal count, and it is mostly either a mature cell or an immature ones. And then one difference between the leukemia reaction and MDS is that the MDS normally have a very low count and they are abnormal as well. What's the symptoms of MDS? Because of the low count of red cells, you will be anemic. The low count of the white blood cells, you will be prone to infection, feeling very sickly all the time. And then also with a very low count of the platelet, which is known the thrombocytes, you are prone to bleeding as well. So anemic, infection, bleeding episodes. Therefore, we can say the MDS has several types depending on one, the type of cells affected and the number of cells that are affected. Also, if you've got very large platelets looking very abnormal and a lot of immature myeloid lineage cells, which we classify them as leukoerythroblastic picture, this is really giving you a clue that there is something wrong with the myeloid lineage of cells. And finally, sometimes you may observe a lot of immature monocytes on the film, which gives you a clue of which type of cancer you are dealing with. Even though it's not the true gospel that all MDS will have this kind of appearance, because sometimes in a reactive state of disease, for instance, a very severe infection would cause the bone marrow to be under pressure to release immature cells, which may mimic the appearance of MDS. Then how do you help your patient? Please refer all these films with the characteristics that we have discussed to your hematology consultant or to the hematology department, and they would investigate further, do further confirmations, use their expertise to know how to go by in helping these kind of patients. Enjoy, see you later.